And hello to you. I'm Mitch McCoy here at KARK4 and Fox 16. We are approximately 30 minutes away from Governor Asa Hutchinson and his primetime address to the state. You can watch it right here as it happens. That address starting again at the top of the hour at 7 o'clock. We'll carry that right here. You don't have to go anywhere. But over the next half hour, we're going to share with you a special presentation from KARK4 and Fox 16. It is called Situation Critical, the State of Arkansas Hospitals. Today, I've had an opportunity to speak with the Chancellor at UAMS and the President and CEOs of St. Vincent and Baptist Health. They give us insight into their healthcare system and the COVID-19 pandemic here in Arkansas, from the coronavirus to the vaccine distribution. It's all right now on this special presentation from KARK4 and Fox 16. Boy, I'm so honored to be joined by three of the leading medical professionals in the Little Rock metro area, in some cases the state. You see there at the upper left-hand corner, Chancellor at UAMS, Dr. Cam Patterson. You have on the right-hand side, Baptist Health CEO and President Troy Wells. And you have on the bottom box there, President and CEO of CHI St. Vincent, Chad Aduddell. Guys, thank you so much for joining me today. I know it's been busy.
Nice to be here.
Thank you for having us.
I want to start with news that's going to be happening here in the next day or two, specifically about a vaccine and a rollout. What can you guys tell me a little bit, and I'll start with you, Dr. Patterson, about this vaccine, and when are we expecting shots in the arm, if you want to call it that?
That's a great question. So we have two vaccines that are going to be considered by the Food and Drug Administration. Today, a vaccine from Pfizer, an mRNA vaccine, will be considered for emergency authorization. And a week from today, a vaccine from Moderna, also an mRNA vaccine, will be considered for emergency authorization. I think that the odds are very, very high that emergency authorization will be granted for both of these vaccines. And we've all been in conversation with our state and federal officials, as well as our local supply chains. The expectation is that the Pfizer vaccine will begin arriving in limited quantities in the state of Arkansas by early next week. Shipments may actually go out over the weekend. These will be on the order of thousands of vaccines, not the millions of vaccines that we will ultimately need. But this will provide us with the ability to start vaccinating our frontline caregivers who are most vulnerable over the course of the next few days, actually.
Well, and that is great news, especially now that we are almost a year into this pandemic. It is just so hard to believe. Let's go to you, Troy Wells. What is the message like at Baptist when it comes to convincing staff to take this vaccine? Because we know the conversation happening in your hospital is happening at the other two major hospitals in our town, and frankly, hospitals all over the country.
That is the conversation that's been going on, and at Baptist Health, and I'm sure many other places, it's been going on for some time. We have really taken an opportunity of the past month or two to really start to educate our staff members about the facts that we know each day. And as those facts change, we of course change that messaging and education, but we want people to be well educated, both our healthcare workers and ultimately the public, so that they understand all the facts about the vaccine, the safety of the vaccine, and that they're a more educated patient when it's time to receive. But it has taken, a while for us to make sure folks know what's going on. We've used our clinicians, we've used information from the CDC, and just make sure it's available to people.
Chad, if you can, what do you think about this stereotype that maybe the FDA might be moving too fast when it comes to approving a COVID-19 vaccine? And what is it going to take from not only the state, but hospitals like yours and hospitals across the country to convince people that it is safe?
So it's really about the data. It's about the clinical trials that have been done, the studies that have been done, the evidence that's out there, as Troy mentioned, about both the safety as well as the efficacy of the vaccine. And so our organization, Common Spirit Health, has been, like all the other healthcare organizations, very much in tune with the data, the information that's out there, watching that very closely. And none of us would be willing to recommend utilization of a vaccine that wasn't safe or effective. And so as that information continues to be reviewed and debated and any side effects reviewed, we're going to be sharing that information with our healthcare providers as well as the public, and hopefully being able to recommend that everyone take it.
I am honored to be joined now by the three executives of the three major hospitals in the Little Rock area. We have CHI St. Vincent, we have Baptist Health, we have UAMS here. And over the next half hour, just picking your brain about COVID-19, the state of it here in Arkansas. I want to go around and talk with each of you about just the state of your hospital. Where does it stand right now? What does the next couple of weeks look like? And what are you doing possibly about a staffing shortage? Let's start, Chad, with the CHI St. Vincent system.
Yeah, great question. We have been participating with the Arkansas Hospital Association, the Arkansas Department of Health, on multiple calls every week with each of our peers around the state, Troy and Dr. Patterson as well. And every day, our healthcare systems are looking at the volumes, both of COVID patients, but also of all of the other patients that we're taking care of. And for context, I would say that this is typically a busy time of year for us. I was just looking at the data, and our number of patients in our hospitals today across Central Arkansas is almost identical to the numbers that we had a year ago before the pandemic. Now, with COVID, certainly we're seeing a number of patients in our hospitals and in our critical care units that we're treating that are COVID positive that we didn't have a year ago, but the overall numbers are pretty similar. And so I just provide that context that as you hear about ICU, critical care capacity, and potential nursing shortages, that you understand each of the healthcare systems are managing the increase in COVID cases. And we all have surge plans that we are used to reviewing and constantly revising to make sure that we're equipped, that we have all the resources and staffing that we need to be able to safely take care of, again, all of our patients, whether it's COVID patients or patients with other diagnoses.
Well, and I've been looking at some of that data too, and it does appear that you know, the hospitalizations and those numbers are identical, but it sounds like the ultimate hurdle each of you are facing is staffing, because let's face it, if 10 people are in quarantine here in our newsroom, people are working overtime, but you take hundreds of people in quarantine because at the end of the day, you guys are dealing with the most sick, you know, that could be a challenge. What does that staffing situation look like at your hospital, Chad?
Yeah, so again, we have to answer that through the context of where we were pre-COVID. And there was a national nursing shortage before all of this began. And certainly the pandemic has exacerbated that shortage. So early on in the pandemic, we began to go out and look for additional supplemental staff from outside the state. So many of the healthcare systems around the state have brought in additional external staff, we call them travel nurses, to supplement our existing staff. And then certainly our surge plans include things like working with our core staff to do more shifts. And certainly we can do that temporarily, but over the long haul, and this has been going on, as you pointed out, nearly a year now, that becomes taxing and tiring on the staff. So we're having to do things to make sure that we're working on their resilience and their wellness. And then, as you described, we've got to do things to keep them safe. That's why the focus on PPE has been there, to make sure that we're keeping those frontline staff that are the most at risk for exposure safe and able to come to work and do their job.
Troy Wells, CEO, President of Baptist Health, are you seeing the same thing?
Yes, it's a very similar story to Chad's, and I think we've heard that same story throughout the year and from all the hospitals all over the state. Some of these, Chad made a great point, the staffing shortage, nursing shortage has existed long before COVID-19, and this has just made the public and everyone else much more aware of it because we talk about it so often. All the challenges that we've faced throughout this year related to the pandemic, for the most part, have been or are being solved by time and money, whether it's additional hospital beds, additional equipment, additional ventilators. We've caught up a little bit with the supply chain and are able to get most of the things we need. Time and money fixes a lot of those things, but what a short period of time and even a lot of money doesn't fix is a nursing shortage. And so just like Chad's organization, we started planning back in the summer for a time when we would be opening new ICU beds at our Little Rock campus. And that meant how many more travelers do we need to be recruiting back in June, July to make sure they're here by December, January, when we plan on opening more beds. So it takes a really long time to make those kind of plans and to find that additional staff. And we're going to open the beds, and you know what? We may not be able to staff all of them on day one. We likely won't be able to. But we continue to recruit, we continue to try and add additional staffing. Maybe it's not always an RN, maybe there's RN extenders that can help our nurses to care for patients as the COVID population continues to rise in our hospitals. And one other point I'd make is our hospitals are really full, they're really busy, but the lengths of stay, how long these patients stay in a hospital bed for a COVID patient is quite long. And so the length of time our patients take to move through the system has created some capacity challenges in our ICUs and our hospitals. And so everything we can do to move patients through the system faster, to get them out of the hospital more quickly, to continue the therapy they need, maybe outside of the hospital, that helps everybody and it creates some capacity for us.
Let's move to Dr. Cam Patterson, Chancellor at UAMS. Doctor, we were just talking last week about the state of your hospital. Kind of catch us up for those who didn't catch that interview and let us know about what's happening at UAMS.
Our situation is similar to what Troy and Chad are describing. We are full. We have added capacity in terms of additional beds, including ICU beds, to manage both COVID-19 patients and patients who have problems that existed before COVID-19 was around, because we still have to provide care for them as well in this challenging situation. And I think that Troy really made an important point when he talked about how we adapt the healthcare resources, especially our most important healthcare resources, our human capital, to manage patients, and doing that in an innovative way so that we do have all hands on deck when patients need us. One challenge that we have is that this is not a problem that's limited to the state of Arkansas. This is a nationwide problem. And all of us here today are competing with hospitals across the country for the limited pool of nurses and other healthcare professionals that Chad and Troy were talking about. And I think we need to give credit to Governor Hutchinson for making additional CARES Act funding available, not only to the hospitals, but to nursing homes and long-term care facilities, so that the leaders of our facilities across the state have flexibility and financial resources to compete at that national level to make sure that the people of Arkansas are well taken care of. And the support through the CARES Act is making a really big difference in ensuring that our facilities are there for 3 million Arkansans.
Dr. Patterson, you were talking a little bit about Governor Asa Hutchinson and some of the CARE Act's funding. Later and very soon, the governor will be delivering his first primetime address. It's our understanding it's going to be related to COVID-19. Troy Wells, Baptist Health President, CEO, what would you like to hear from the governor tonight?
Well, I think I expect to hear what we've heard all along, and that is an attitude of strength and things we need to do as a state to protect ourselves and to help our hospitals and nurses. I expect that he'll speak about the winter task force that's been meeting now for about 2 weeks and has made a tremendous amount of progress under his leadership. Some of the things we've mentioned here today, the CARES Act funding, the throughput issues, the governor's office has worked with the insurance companies, and that's provided some relief for hospitals to help us move patients through the system more quickly. And I expect to continue to hear the message that he's given throughout the year in terms of how important it is that we protect ourselves and protect others if we expect this pandemic to subside here in Arkansas.
Chad Aduddell, President and CEO of CHI St. Vincent, what would you like to hear from the governor here soon tonight?
Yeah, similar comments that Troy made. Also would like to hear optimism, I think, with the impending vaccine and the opportunity to see that begin to be distributed over the next few days, and then being able to immunize our highest risk coworkers that are taking care of COVID patients is a message that we're excited to hear. And then I think as we head into the holiday season, a message about the greatest gift that any of us can give to one another is continuing to be vigilant around masking, our own personal responsibility for social distancing, and despite the fact that it's tempting at this time of year, avoiding those large social gatherings. So doing the right things will be a gift from each one of us to our family members and to our neighbors in keeping them safe.
Dr. Kim Patterson, UAMS, what would you like to hear from the governor?
I would agree with everything that Troy and Chad just said. I think it's really important that we have a focused national and state level dialogue about the importance of getting vaccinated. Unfortunately, there's a lot of misinformation about the vaccines that are out there. Let's make this a science-driven decision, and let's talk about why people should be vaccinated and what the real impact is. There's two reasons to be vaccinated. One is to protect yourself, right? So that you don't get COVID-19. But an even more important reason to get vaccinated is so that we can get to that 70+% level of protection in the community that will give us herd immunity so that COVID-19 will begin to go away. COVID-19 is not going to go away just because a few of us are vaccinated. We're going to need 70% or more of our community vaccinated before this pandemic begins to abate. And we need to particularly focus, and I hope that the governor will particularly focus on engendering trust in those communities that have been difficult to reach, especially minority communities who, for very real, important historical reasons, might be distrustful of the benefits and risks of taking a vaccine. So we've got to have a focused, powerful, science-driven conversation about why we get vaccinated, the importance of it, the benefits and the risks. And I hope to hear a lot from the governor about that tonight.
Dr. Patterson, do you think the governor's speechwriters, it's always interesting to think, okay, what are they, what's that message they're going for? And it sounds like from what you just said, he's trying to reach multiple different people, no matter their background. In some cases, he has to put the dad pants on, and he has to have a very stern message as cases skyrocket and that death rate continues to increase. But then he also has to instill trust coming out of a vaccine. How does he do that? How does he reach all of those different people?
Well, that's why he's the governor, and that's why we're going to show up with a box of popcorn to watch how he pulls this off tonight. But he is very good at putting partisan issues aside when it comes to matters that affect our community here in the state of Arkansas. And I know he's going to do that. He's been listening to us, those members of the Winter Task Force, but he's been talking to people all across the state. He's been out all across the state, hearing, listening to what people have to say, understanding what concerns there are. He's been studying the data that are coming from Pfizer, from Moderna, so that he knows the benefits and the potential risks. And he has an excellent ability to shoot down misinformation in a calm, trusting way. I think he just needs to continue to be himself. And then it's up to the rest of us to amplify that message, to take that message to our team members, our constituents, the people that we care for, and amplify that in a critical way. So the governor's message tonight is the first step, and it's up to the rest of us to carry the water for him to get that message out to 3 million people here in our state.
Well, Dr. Patterson, you have, we were talking last week, and Chad, Troy, I don't know if you guys saw our story, the latest projection from the UAMS College of Public Health talking about the that forecast of deaths. We're talking about more COVID-19 deaths in the next 2 weeks than the first 4 months of this pandemic. It's very interesting. The governor plans on doing his first ever primetime statewide address here just in a little bit. I'm interested in hearing from Troy, Chad, and of course you, Dr. Patterson. We'll start with Troy Wells, Baptist Health. There were some comments about from the governor saying that he might impose at least one additional restriction, meaning private gatherings under 10, or you'd have to get approval from the Department of Health, something his team and health officials are now considering. Do you see or do you think the governor needs to impose additional restrictions as we see COVID-19 cases? And it's funny, I was going to say increase. They're not even increasing at this point. They're staying, very steady at more than 1,000 cases a day, or 2,000 in some cases. So it's like we're just kind of hanging out in this 1,000 range that we've never been in before. But back to my original point, do you think that additional restrictions are needed?
Well, the Winter Task Force continues to talk about some of those examples of further restrictions. And the good news is our governor listens really well, and he seeks out good advice and good information. And what he has said all along, when there is evidence or data to support a measure, then he's interested in pursuing those measures if he thinks it will make a difference. And so I haven't seen the data on the gatherings, but if gatherings are clearly an issue, I expect that he's considering those and the size of those gatherings and what kind of things ought to be in place to do it safely, whether it be having it approved with the Department of Health or otherwise.
Chad Aduddell, President, CEO, CHI St. Vincent, your thoughts on additional restrictions? Are they needed?
Again, just as Dr. Patterson and Troy described, I've been very impressed over the course of the pandemic with the governor and the health department listening every single day, every single week to each of our institutions, as well as all the other healthcare organizations across the state, looking at the data, conferring with the experts. Ultimately, the governor has to make some difficult decisions on what are the levers that he can pull that balance both the needs of the community, the economy, but also address where we are in the COVID pandemic. So I think that, again, he's taking all of that information, all of our feedback, all of our recommendations, and then ultimately we'll hear from him and his team what those levers are that need to be pulled, if any, in addition to what we're already doing. But again, going back to the science, it would tell us if we are masking, if we are social distancing, if we are washing our hands, if we are being careful about avoiding those large social gatherings, then those things are effective. And so if we don't do those things, then yes, you're going to hear more discussion about other or additional restrictions.
Dr. Cam Patterson, Chancellor at UAMS, and not to mention a kind of a fixture at the governor's COVID briefings. What are your thoughts?
Well, I agree with what Chad and Troy are saying. The science is pretty clear, and from a strictly a healthcare perspective, the answer is simple. But when you add in the economic impact, the effects of restricting schooling and other things, it becomes more complicated. And that, I think, is what has made this such a difficult decision for the governor. The real issue is one that I would turn around. We've got to convince people to follow the guidelines. We've got to convince people that the science-driven approach to managing the pandemic actually will work. And unfortunately, our biggest problem isn't that the governor is too risky or is risk averse. The biggest challenge that we have is people are not paying enough attention to him. And I think that we've got to find a way to reverse some of the misinformation that is causing people to behave in very bad ways across our state.
Being 9 months in now to this pandemic, is it possible to reverse some of that misinformation? Is it possible to, lay the hammer down and crack the whip, if you want to call it that, to get people to, wash hands, practice social distancing, wear a face covering, and avoid large crowds? Is it possible to reverse that, Dr. Patterson?
Of course it is. There is no doubt in my mind that at the end of the day, people in the state of Arkansas are smart, they're health conscious, and they want to do the right thing. We simply need to convince them that these very minor impositions are not destructive to their civil rights, that they are not random, that there is science that backs them, and that we're not going to crawl our way out of this unless we all engage in proper activity. So I don't think for a minute that we can't convince Arkansans to do the right thing.
Troy Wells, Baptist Health President, CEO. Last week, Dr. Cam Patterson sent out a letter to his staff letting his leadership know, hey, you guys should not travel over the holidays, highly discouraged. It's possible that they were going to be called in. What is the communication like at Baptist when you're communicating with your staff about the upcoming holidays?
Well, first and foremost, we want to ensure that people can get a break. It's been a difficult year. Many people have missed out on vacations. Obviously, it's been stressful not being able to see family members who may live in other places. So while we want to encourage people to take a break and take some time off and enjoy the holiday season, our leaders also know about their responsibility to the health system and to the people that we serve, and we're all available. So we're going to plan some time off and try to get away, but at the end of the day, we're always working, and we're always available for Arkansans and to do what we have to do to take care of people.
Chad Aduddell, President CEO of CHI St. Vincent. What about at your hospital system?
Similar message. Our healthcare system it's a not-for-profit ministry, and the people that work here connect with our mission and our purpose, which is one, to serve, and it's also requires it demands personal sacrifice, and so we are recommending, again, as Troy described, for people to, where they can, take a break and continue to recharge themselves so that they can come back and continue to serve. But then it's also balanced with that message of personal accountability when they're away from our hospitals and clinics, that when they're out with their families and they're considering what to do around the holidays, that they make sure that they're keeping themselves safe so that they can come back and serve. And from my own personal experience, we had to make that difficult decision around the Thanksgiving holiday, not to travel home and see family back in Oklahoma. And instead, we enjoyed Thanksgiving, much like we're doing here with this conversation this morning, over Zoom. And got the kids to see the grandparents, and it actually went very well. And so again, it's a disruption for everyone. It's a sacrifice, but it's an important one at such a time as this.
All three of your boxes are up on the screen right now. Last question, if I could just maybe raise your hand, because Zoom will cut out everybody's audio. Who is willing to take the COVID-19 vaccine when it comes out? There you go. The three top professionals when it comes to the health field right here saying that they will all take that COVID-19 vaccine when it comes out. Gentlemen, thank you for your time, and thank you for everything you guys are doing for the state of Arkansas.
Thank you.
And there you go, our one-on-one with all three of the major hospital officials here in Central Arkansas. We have been monitoring all of your Facebook comments. Just a reminder, we are moments away from Governor Asa Hutchinson's address to the state. We are in standby mode. The governor will be addressing the state here in about 2 minutes, as it's our understanding he will talk about COVID-19 and the vaccines. If you're just joining us, good evening to you. I'm Mitch McCoy. We are in a special program right now talking about the current state of the hospital system here. If you missed any part of our program, you can watch it right now in its entirety at KARK.com and, of course, Fox16.com as we watch all of your Facebook comments come in here. The hospital officials were talking about the coronavirus. They were talking about vaccine distribution. Vaccines could start arriving as early as next week here in Arkansas. For the frontline healthcare workers, those individuals would be first in line for a vaccine. We're going to take a quick pause. Stay right there. The governor's news conference is coming up here in just a moment, his rare prime time address, but we do want to quickly allow viewers in across the state into our special coverage as we stand by for Governor Asa Hutchinson. Stand by.